Thank you very much for the privilege of this presentation. Today, I will be speaking on predicting future violent recidivism among young adolescent firearm-related assault patients. Firearm-related injury is a major source of pediatric morbidity and mortality. A majority of these injuries are assaults, and homicides are the second leading cause of pediatric death. Violence is therefore a major threat to children. Adverse childhood experiences, or ACEs, are associated with various poor outcomes in childhood. I asked the question whether ACEs associate with an increased risk of future violence, specifically among a population of firearm-related assault victims. We did a retrospective review of trauma registry data from our Level 1 Pediatric and Adult Trauma Center. We looked at adolescents aged 13 to 16 who sustained a firearm-related assault injury over a 10-year period. We used registry and electronic health record data to collect the following 4 categories of adverse childhood experiences and the following outcomes, including our primary outcome of a subsequent violent event. We utilized multivariable Cox proportional hazard modeling to arrive at adjusted hazard ratios for the listed predictors for our primary outcome of interest. Our cohort included 110 children with the following distribution of adverse childhood experiences. Roughly 70% lived in a single parent household, roughly 20% had involvement of children and family services, 20% attended an alternative school, just over half endorsed using marijuana, about a third had prior psychiatric or behavioral problems, 20% prior violence, and about 5% with a prior firearm-related injury. Among survivors, about 40% had a future violent event. Strikingly, half of these events involved a firearm. In terms of predictors of future violence, prior legal involvement, foster care, female gender, parents with prior legal involvement, and attending an alternative school were all associated with an increased risk of a future violent event. In conclusion, adolescent firearm-related assault victims have a significant burden of adverse childhood experiences. Frequently, they experience violent recidivism, including recurrent firearm violence, as well as future legal and worsening or new psychiatric or behavioral problems. Specific ACEs seem to be associated with an increased risk of violent recidivism and therefore could be markers for at-risk populations. Thank you very much for listening to my presentation. I'd like to thank the following individuals.